All right, are we ready? Just 1 more minute and it's time. All right, time up. Time up, everyone. Time up, time up, time up. What are you still discussing that you have not discussed? Okay, so let the group heads come out. Let the group heads, all of you. Group 1, group 2, group 2, group 3, and group 4. Encourage them now as they come out. Take it easy. Encourage, better support your own. No more discussions. All the group heads come out. Encourage them. Clap, clap, clap. Otherwise, I will swap with any group member. You have better just support your people. All right, so group 1, the floor is yours. So, we're listening. So please tell us your name again. And that you represent group 1.
Yeah, my name is Lsetf, and I represent group 1. In the first study here, we got to like discover negligence of duty.
Okay. I think it would be nice to do an overview
Yeah.
of the case. You know, and then now point out, okay, so whatever it is that you have observed.
Okay. What happened here in the story was that Madam Sophie is a 79-year-old woman.
Don't read everything, no, just
She arrived at home after.
You don't even have to mention name, you know, confidentiality. So start practicing here. Yeah?
Okay, a woman arrived at her home after recovering from an hip surgery. So a routine was actually done at the hospital without complication, and the carer was given a care plan, which consists of what the carer, what mama was to do every day to like increase her chances of recovering. And in the process, like after 3 days, mama was doing great and was on her way on getting herself back into shape. Then something happened. We discovered along the line that mama actually removed elastic stockings, which were supposed to be on throughout the period. Um, the carer also gave some documentation which were not correct, and as a result of her negligence, mama died. So now,
So she was negligent.
yes,
What way?
okay. The carer, she never recorded the right thing because
How do you mean?
we were told mama after shower, yeah, we were told that
Do you want to take your eye, please?
no, we were told that mama removed her elastic stocking for a shower before bed. Then after the shower, she felt a sharp pain in her leg and report carer and went to bed without discovering it. But in the carer's report, she wrote that mama's stocking was on. That means she never checked on mama, or probably she didn't write correctly. So she neglected her duty and wrote a false report
Okay.
on what actually happened. Um,
1 more minute.
we can also call it dignity of risk. Also,
I call it.
dignity of risk, like the negligence, dignity of risk. We can also say they didn't follow the care plan because care plan is what is listed for a patient, a carer's duty to a patient. She didn't follow it. Then there was a breach in communication, like there wasn't a precise, complete, and clear message. Communication skills was not observed because the nurse the nurse wasn't giving a feedback or an oral report of what was going on. It's not compulsory the nurse should be there at the moment. The job of a carer is to observe, and if there is any emergency, she can just call the nurse. But she didn't. There was no communication, breach of communication. There's no effective teamwork. As a carer, you have to work together with whoever can help in supporting your client. So there was no teamwork between both the carer and the nurse. Then their actions, both the nurse and the carer, their actions can lead to disciplinary actions, which may range from fine, termination of appointment, or even court case.
All
So
right.
in all, their negligence.
Thank you. Keep standing. Don't worry. All right. Group two.
My name is Rodula. I'm representing. So from the story so far, I know that the carer is benefiting was that when Mama removed her suffering, she feel pain. So she was not the carer was not even she don't know her client because if she had known Mama, she would have known that Mama is in pain after removing herself. And again, when Mama even went to bed, in her report, she lied that Mama was fine. That means she did not even her ADL was she did not take it out very well. She just went to answer that Mama is fine, assuming Mama is fine. Okay, fine. After she has noticed that Mama has moved herself and she's been painful, she did not even call her superior to tell them, no, this is what happened after Mama removed herself. She's been pain. That should be evidence on her own to and against she's not even observer. Fine. In her record again, she lied. Where she's not supposed to lie that Mama is fine. She assumed saying Mama that Mama is dead like that. She feel Mama is fine, any other thing is okay. So then she lied in her record. And the second to the last one, for the nurse, there's no teamwork. Because if she had talked to the nurse, even not listening, I thought to the orally that this is what happened. If she, I felt, all because she has lied in her report, that's the reason why she did not bother telling the nurse that this is what happened. So there's no communication in that time. And the last one, where the last one, the last, okay. So the last one, so what I felt is she she was scared after she had lied in her report to tell the nurse because it's another fine on her own. Now that Mama is dead, there's nothing she can do again. She has been caught, so it's probably she paid fine. So that's all I know.
Okay. Let's appreciate her. Group three.
Number one, number one, there's a lack of communication between the nurse and the daughter-in-law and the carer. First of all, when you get to a home, if you met, okay, if you meet someone in that home, all you need to do is team up with that person, another people are there. And finally, that person knows what is happening to that person. But she lack of communication, number one. Number two, teamwork. She noticed, okay, Mama did not tell her that she removed the elastic. For her, number one, she had to go inside and check Mama every time to time, in order for her, maybe Mama had to put that in the front. But she didn't do that. And she recorded something that Mama was fine, which is not supposed to do. And she lied about that. Number two, when that thing happened, and Mama told her that she's feeling dizzy, the first thing she did, she checked Mama Bagata. When Mama was feeling dizzy, she checked Bagata and she reported something that Mama is okay or was okay, which is not supposed to be recorded, but she recorded. She should be able to call her supervisor and tell Mama and tell the supervisor what is going on before recording anything. And also, the nurse to be able to call know what's going on, not for you to go and look at something. Even if mama asks you to go outside, you have to let her understand to some extent that I'm here for you, not to have you. But she went out, maybe I don't know what she's doing. But she, in other words, she came in the morning and noticed that something happened. If there's a good communication between you and mama, and you ask mama, are you okay? And she said, mama said, I'm okay. Her reaction on her face should be able to tell you that something is wrong with her. And before you take her back, you should notice that mama has removed something from her hip. So what I noticed that in that lack of communication, lack of teamwork, and negligence.
Why didn't you shout your shout? All right, so group 4. They can't hear you. You have to speak out louder.
Good morning, everyone.
Good morning. Okay.
Yeah, I'm representing before. And here before me, there's a case study, so I'll just give a summary of what happened here. Now, this case study is about a 79-year-old woman who probably went for Omugo in her daughter-in-law's house. So while she was there, she had an accident. Maybe she fell and her hip got dislocated, which landed her in the hospital, and she underwent the surgery. So after the surgery, she was recovering, and then she went back to her own home, where she was assigned a nurse and a carer. Now, while she was at home, after 3 days, Mama was already regaining her confidence. Like she was regaining.
I'll smack you.
Like Mama was already
Oh, there's
regaining
no,
her
we don't have
independence.
virus here.
She was already able to move by herself and do things by herself. So what I actually observed here was that the carer observed that Mama was already regaining her independence, and they gave her freedom. Those are taught in the duty of care. Like the carer thought, okay, and since she can do this, she can do that. I shouldn't be in total control again. So the carer, which along the line, then she neglected Mama because she felt Mama was doing her own care all alone and she was fine. And also along the line, the carer made a duty. Like her duty was to always note down what is going on with Mama, but she made it a duty to write down her daily report. She felt normal. Mama is already doing fine. So she just made the report, a routine report, nothing changed. So even if she checked on Mama or she did it, she would just write a report, Mama is fine. So the night that Mama had this unfortunate incident that led to her death, it can be ascertained that the carer was not with her that night. Probably the carer was maybe in the kitchen or in the parlor watching movie. And Mama said, oh, okay, Lord. She went to the bedroom. She pulled off her stocking, had her back. But she had a pain in her leg along the line. And with that pain, it's not expected that she will put on her stocking. She felt, okay, let this leg breathe. Then she went to bed.
Okay.
So it can also be ascertained that the carer did not later go and check on her. That, let me see this woman. The carer didn't check on her. Because if she had checked on her and asked her that, Mama, are you fine? There is no Mama would tell her that, no, I'm not fine. Oh, there's a pain on my leg. She didn't check, she didn't ask anything, and then as usual, she went back to her report and wrote, Mama is fine, she's sleeping comfortably. So in the morning, when she went to check Mama, Mama, good morning, ma, and everything. Mama complained to her, I'm feeling dizzy. And she felt that okay, yeah, okay, you're feeling dizzy, let me check your vitals. She checked Mama's vitals and she knew something was off. The vitals were not okay with the complaint. Then, as usual, with Sarah, she took her pen and she knew that that case was a case of emergency. Someone that is sick, she was already feeling dizzy. You didn't even do anything, you didn't do anything, you just put down a report. What you were supposed to do was just to put a call through to the nurse to get an order from the nurse. Either to take mama to the hospital or the nurse would have said, I'm coming, though. And the nurse would have rushed down earlier to check for mama. Maybe the nurse was supposed to resume at 9 or 10. But if she had called earlier, the nurse would have been there around 7 or even 8 to check on mama or to give an order that she be transferred to the hospital. So the carer, how this thing went bad was that the fault and everything was just on the carer who neglected mama. She neglected her own duty because noticing a case of emergency, you're supposed to give an oral report, not just a written one. And then when the nurse came in the morning, she read the report. Okay, the report said, okay, mama is fine and everything. Then she went to check on mama, but what she saw was that mama was already dead. So I'm sure that carer, no.
You should not clap, Abby. All right. Well done, everyone. Please celebrate that once again. Celebrate that once again. It's not easy standing in front of people to talk. So celebrate them once again. All right. Do we have questions? I expect us to have questions because I have loads of questions. Do you have questions? Have they all presented everything? What they said was all correct. Nothing to add, nothing to. Okay. Sorry, this place is hot. What's happening? Tell FM now that you should give us a say. Oh, why does it have to be? Is it because of this? Okay, yes.
Yes, ma'am. My name is Paul.
Omogana.
Yes, I'm a group one.
Go ahead and make your business because we short, Joe.
In this scenario, ma, what I think add is one. You said that mama took a bath. As a carer, the same way you assist your carer in ambulating, in either feeding disorder, you have to bathe, dressing and undressing.
Is it compulsory you have to bathe everybody?
It's not compulsory.
Exactly.
Dressing and undressing.
If it's an independent person, can take his or her bath by themselves.
Even if the woman took a bath herself, as a carer, you are supposed to observe the environment of the bedroom. You are supposed to observe if she's comfortable. Is she the kind of client that can stand or sit to be?
Did she have a problem in the bathroom?
It is said here that she took off her socks.
When she wants to take a bath, she will take off her socks.
She took off her socks. Why? Because probably she is causing her discomfort. If the care had been there, the care would
Okay, please, you can sit. You can sit. You can sit. We'll call you if we need to.
If the care had been there, the care would have observed that mama took off her socks after this, and before this, and after this. Also, she did not talk mama to bed. As a carer, even if you are not assisting your carer with mobility, your carer can walk.
Your client, or your service user.
Your service user or individual, the individual can walk. You are supposed to talk her to bed, put her to bed, make sure the bed spread, everything is intact. She lies, observe her. Then at midnight, at intervals, you are supposed to also do a routine check on her. Then
don't give us another lecture. Okay. All right. Okay. Someone has something to say? Hello. You have something to say? Please just go straight to the point.
Not just lack of
Okay. Just a little. Whatever has not been mentioned.
Okay. From the last part, yes, there was no effective communication between the nurse and the carer.
All right. Okay, so I will. You want to say something? Okay. I like the way she painted that scenario. Okay, or whatever it was that happened to this woman. Number one, do you even think that the socks was removed? Okay, and the carer did not know. She did not know. She did not know. She was just like she said, Mama is okay. She doesn't probably need so much of help. After all, she tried to do her things by herself. She was busy punching phone, watching movie, when she was supposed to be observing our clients. And many caregivers are guilty as charged. Busy, so we are not observant. It's absolutely important that I say you must be present. Yes, we know you are there, your body is there. But sometimes you are there, your mind is off. You are at home, you are God knows where. You are physically there. But whilst you are with your client, you are supposed to be there for them. Because something as major as this that looks minor, you miss it if you are not there. You are not present. The camera is there, but honestly, she wasn't there. That's number one. Number two, so the abnormal vitals were documented correctly. What does that tell you? She knew how to do vital signs. She wrote the vital signs. All right. She does not know the meaning and interpretation of the vital signs. Excuse me. So it's one thing for you to know how to take blood pressure, how to take blood sugar measurements. It's another thing for you to understand the meaning and the interpretation of what it is that you have done. So she wrote, she checks vital signs. The blood pressure was low. Yes, she knew this was abnormal, but she did not understand what this figure meant. That's why, if it was that she wanted to cover up, honestly, she would have covered us very nicely by even reporting a normal figure. You understand? So it was a point of she knew this was abnormal, but she does not understand what this figure meant, which was why she did not escalate. If she had known that this vital signs figure that I got, they are not normal, she would have known that I need to talk to my supervisor. I need to talk to the nurse. I need to do this. I need to do that. Not just barely recording it and documenting it. All she did was just document. They told us we must always document everything. So document. So caregivers working mechanically like a robot. Not understanding and knowing that everything that you do has importance and a meaning. Excuse me.
They're broadcasting live. So when you were making reference to the heat in the environment, they're actually broadcasting live this
Okay.
session.
Now why they do it though? Okay, so you've got to be very careful and intentional. You are a caregiver. You are meant to be using all that you have been taught and your knowledge of the care. You are not just there because they said we'll be there. Like I keep telling you, anybody can assist someone to take a bath. You don't need to be a caregiver to do that, for crying out loud. House boys, house girls can do all of that. So what's the difference between you and a houseboy and a house girl? Is what you have learned, is what you have upstairs. And if you are now unable to apply what it is that you have learned on the care, then you are no longer working as a caregiver. You are now working as, yeah. So she did not know. So your vital signs that you have been taught, that you continue to be taught, you must understand what it means. At what point should I escalate? At what point will I blow the whistle? All right, because the same reason, if she had understood when the woman said she was feeling dizzy, are there caregivers? Do you remember there is only one person that you're taking care of? The reason why you're bothered to have the care plan, the history of your client, and all of that is for you to know what it is that you're dealing with. So they've told you that this person, yes, we know you're not a medical person per se. They've told you that this person had a hip surgery. Uncle Google is your friend, you know. Do you bother to go and read, okay, so hip surgeries, what are the things that are likely to happen? Did you even bother to ask when they said mama should wear socks? Why is it that they wear elastic socks? What's the reason for elastic socks in this kind of situation? So that if you knew, and those are questions you can even ask. You could ask the nurse, and if you were there in the hospital when they were giving you all of that load, you could actually ask, or you can even find out. That's why you're a trained person. That's why you're educated. That's why you're skilled. To find out, okay, so they will have told you the importance of that socks, which will now make you and help you to know that, oh, it is so important. I cannot afford to be careless with this. But you see, when we are working with no understanding, with no knowledge, we just walk anyhow. This was a careless way. It was a case of somebody just walking. I'm a carer. They say I should do. I'll do what they ask me to do, but you're not really applying yourself as you should. You're not even really applying yourself as you should. And of course, because all of us, she didn't know the reason why the socks must be on. She didn't bother to ask. She didn't find out, and then she was careless. And yes, many caregivers, when you go through their reports, sometimes it's repetition. It's repetition. Because as far as they're concerned, some of them will even write a report for 1 week ahead. Can you imagine? Such a criminal thing to do. You're not, so you're writing a report. She woke up, she ate, she drank, she left, she went to bed, and that is it. And that's your report. So what significantly happened in the day? Nothing. Because you don't think and you're not applying yourself as you should. And of course, because Madam Caregiver, yes, documented, obviously did not understand what she documented. She did not act. She cannot give another report because she doesn't understand. Well, the least she could probably have done is that at least she knows it was abnormal. So you now tell me that you have written it in my report book. Because if you're going to ask this caregiver now, but you documented this, or this happened, what happened? I checked the vital signs and it was abnormal. And then because it was abnormal, I wrote it in my report book. You see, when caregivers tell me those kind of things, I'm like, okay, so you expect me from wherever I am to shoot my telescopic eyes into your home or wherever you are, read your reports. And so that's how you expect your supervisors and managers and doctors to be reading reports. We have telescopic eyes and we are reading everybody's report. If you think that is important, shouldn't you report orally like you all pointed out? It was urgent that this had happened and she would. But because she does not even, to the caregiver, she does not understand any of this drama. She knew they were not normal. You don't need to understand everything. What you can see escalates. You are not medical people. We know. But at least what you are seeing, this is not my client. She's behaving a little bit differently from what I know. And the vitals, the heart rate, these are how in the morning, everything had happening. And she saw. And she did not report. So at the end of the day, of course, this woman could have been saved. Yeah. If there was effective reporting, if there was timely reporting on the part of the caregiver. And so one of the complications that we know very well that can occur post-hip surgery is DVT, is deep vein thrombosis. The man threw an ambulance, and the woman threw an ambulance and passed. This woman could have lived for another 10 years, could have lived for another 15 years. Many older people die untimely deaths. Yes, they are old, but they ought not to have died at that time. They died as a result of carelessness of caregivers. And I mean caregivers now family inclusive, not necessarily just paid professional caregivers. When we are celebrating, you say a life well lived. We will not say a life cut short. All right. So that takes us to what it is that we are talking about today. Documenting and reporting. Documentation and reporting. That's what we're talking about today. Documentation and reporting. I hope everybody's phone is on silent. No phone must ring. Proper, accurate, and timely documentation. Proper, accurate. It's got to be accurate. It's got to be proper. It's got to be timely. Documentation and reporting communicates the quality of home care that you provide for your clients. Timely reporting, accurate documentation, timely documentation, timely reporting, accurate reporting. I'm repeating those things because they are absolutely important. That is why you are there as a caregiver. You cannot be absent-minded on the job. You have issues, we all do. But you see, you put them aside. Once you get inside your scrub and you get on the job, put your worries and personal issues aside and focus on your service user. That's why you're there. It mitigates risks and reduces the chance of malpractice. When there is timely reporting and proper documentation, we're able to act immediately or promptly. In this case, even if nobody is there and all that, all you needed was just call. This is happening to my client, and within a flash of an eye, we can send in an ambulance to the home, pick the client, take the client to the hospital, get a doctor in there, whichever is going to be fastest, and intervene. This case will have been saved. And by the time you have your first aid course, CPR and all of that, you'd also know the importance of timeliness. A well-documented record can help alleviate liability concerns in the event of a claim. As caregivers, I've told you, you have come into the healthcare industry. And in the healthcare industry, I hope you know that a life has been committed to your care. So your carelessness can be fatal. Just like we saw here in this case. Your carelessness can be fatal, extremely fatal. Not only can that be, you can also expose yourself and your organization to litigations. So why it is important for you as a caregiver to document and document appropriately and document accurately. cannot be overemphasized. It helps in taking informed decisions. It helps in taking informed decisions because I have adequate information. We're able to take proper decision. What is best in this situation, under this circumstance, in this scenario? What do we think is best? Because reporting is accurate, documentation is proper, and all of that. Then you know, you're able to know what it is that we should do. Proper, accurate, and timely documentation and reporting helps with statistical information that can be utilized for planning clients' future needs. I was talking to the caregiver of a service user this morning, and we were just talking around the clear. And I mean, there are some truths, insights that that conversation brought to the fore, and it will absolutely help the service user in planning future care. But you see, when we don't have accurate information, we don't have proper information, it's difficult to be able to even plan for the services of our clients in the future. So it's absolutely important that not only is a caregiver observant, present, caregiver is also able to report accurately. And then we'll take it off from there. Proper, accurate, and timely documentation monitors the quality of care received by the client and the competence of the caregiver. I hope you know that on the job, you are going to be rated, and it's a continuous rating. Okay, so it's a continuous rating, which means that you as a caregiver, and we've told you that learning is continuous, you must continue to learn and improve on your skills and on yourself so that your rating continues to improve. Because in the world of care, in the industry where you've come to, it's an industry that is always evolving. It's an industry that several things, research findings, and all of that is always available for us to improve on what it is that we do. And so for you as a caregiver as well, you must continue to improve yourself. So when you report and document appropriately, we're able to help you also know the area that you need to strengthen in your skill acquisition and your journey of caregiving. Documentation. What is documentation? Documentation is simply writing down, all right? Writing down, yeah, writing down information. Writing down whatever you know. Writing down, black and white. In the healthcare industry, documentation is major. There's nothing that you do that you are not meant to report. If you fail to report, it's assumed that you did not do it. If it is not documented, that means you didn't do it. It's not done. So what you did, write it. And it is a permanent record of a client's information and care. So be careful what you write. And be careful that you are writing truth. Don't use words that you don't know the meaning. Their caregivers, they use words. They want to speak English. But they don't understand the meaning of the word that they have chosen to use. The word can mean something else entirely. Meanwhile, they are saying something, they mean something else. I've seen that before. Whether you are writing or you are saying it, don't use words you don't know. If you want to use, you like the word, go check up the dictionary meaning and be sure that, okay, this is what I really want to say. So in documentation, In documentation, please make sure that you say what you really want to say. Don't say what you don't assume that that's what you thought it meant. Because once it's written down, it's permanent. By the time you begin to clean it and erase it and all that, we might be able to question you. Because God forbid, if there's litigation, they go back to all those documents. So that's why I tell caregivers, everything that you are written is a legal document. Can be used against you. Can be used for you. It can be used against you. So be careful how you write. You're not writing a letter to your friend. No. It's an official documentation. It's an official reporting. So you report officially. Anything you do not want someone else to see, please don't write. Effective reporting. Timely reporting can be hourly, depending on what it is or what case you're dealing with. Can be daily, can be weekly, it can be monthly. If you're working in a care home, you write as you work. If you're working in the domiciliary setting, you write with time as you work. Even if you are not going to be able to write in your proper reporting book, you must have a jotter that you're carrying to note the time. Do you know why the time is so important and extremely, you must take note of the time that a certain activity is being carried out? Because, like I said earlier, it's a legal material. Unusual events, just like we saw in this woman. Report anything out of the ordinary that happens while you are with a client. Anything unusual. This is not normal. Anything that is not normal. You might not be able to understand what it is, just like this kid did not understand what was going on. She did not. She's not a medical person, so she did not. But at least she knew something abnormal was ongoing, which should have been reported immediately. Notify your supervisor immediately. Notify your line manager. Notify if family members are in the house. Notify them immediately. This is happening and all that. At least if the caregiver is not alone with the client, maybe there are other people in the house. Could have in fact notified someone else in the house. And this is happening to mama and all of that. And then you'll be able to act appropriately. So, your caregiver information cycle, assessment and evaluation of reports. You have seen something abnormal, or you've done your due diligence and all that. Reporting and action. What did you do when you saw what happened? What did you do? Yes, I reported. Report, so in your report, I observed so and so at so time, and then I reported. Who did you report to and at what time? And you have heard the module on effective communication. What was the response? Because I will say, oh, I sent her a text or a chat. What if your supervisor was not online or was not available immediately to read your messages? What else did you do? What else did you do? So it must be written and oral as well. Which is why we insist that everyone, caregiver, can't be on duty and tell you don't have call card. It's not acceptable. Even if you cannot call, you must have enough flashing credits. If you cannot call, keep flashing. By the time the person sees that his phone is buzzing, what is there? And it's consistent. Even if the person is busy, I tell you, even as busy as I can be, once I see a message from a caregiver and it's consistent, if you say you just tried once, it might not take it, it might not mean an emergency. But keep trying. Something is happening. You need to attend to this thing. Documenting. You document what you have not done. factual, specific, and accurate. Don't make up stories. Don't tell lies. Don't tell lies. Don't say what you did not do, and don't say what you did not do. Don't say what you did not read, what you did not see. That document can travel anywhere. That document can travel anywhere. So you have to be careful. So making observation using four senses. We said this particular caregiver was not observant, right? We expected that if she was looking at our client and she was present and she was careful to monitor this woman, she would have seen, at least she would have seen facial expressions. She would have seen uncomfortable body movements that would have shown you that this person is uncomfortable. With your eyes, you can see a client's need. Daily activities of the client, like eating, drinking, bathing. So you observe that, oh, this person will usually finish this helping of meal. And then today, person is unable to take even half of the normal. That's an observation that you can see with your eyes. Oh, on a good day, this person will jump out of bed and all that. And now, yeah, this person is unable to just drag in to tell you that something is wrong. Unknown to you, maybe the person is having a stroke, early onset. Maybe this person is becoming feverish. Maybe something is happening. You've seen something with your eyes. Document and report. You've seen the body posture, skin color, bruises, swelling. Those are things that you can see with your eyes as a caregiver. Breathing pattern, we saw that. Breathing, the woman was having shallow breathing. You understand? Those are things you can see with your eyes. Bowel movements, including the color. Yeah, very important. Oh, the stool is very black today. Oh, there is blood in the pool. Oh, it is extremely watery. Those are things you can see with your eyes, which must be reported and documented. Urine color, urine quantity. Oh, this person has not urinated all day. You don't know how important that piece of information is. Extremely important. So, we're not necessarily asking you to know everything. What we're asking is please be present, please be observant, and report immediately. With your ears, you can hear the client's rapid breathing, coughing, sneezing, sometimes breathing in pain. You can hear. You see, so a caregiver who is absent-minded, who is only physically, bodily present in the client's place and not fully present, will not know that all the senses must be utilized. With your fingers, you can feel a client's skin temperature. Oh, this person is warm. This person is very cold. You can feel the pulse. You've been taught how to take pulse. How do you know that when you are doing your practicals, you will do all of this? So if there are areas that you are not comfortable with, any free period you have, keep trying. Keep trying. Nobody will stop you. Keep trying on each other. You understand? So that you become comfortable. That's the whole idea. So that you become comfortable. And then you also become comfortable when you do wrap-ups and all that. You're able to ask your questions and all of that. So skin temperature, skin texture, the pulses of a client, you can feel it. Oh, it's very fast. You may not understand the full meaning, okay? But report. It's an abnormality. Report. With your nose, you can smell a client's breath. Do you know there's some breath that smells? Yeah. Yeah. Body odor, environment as such an unusual chemical odor or gas leaks and all that. All those things are absolutely important. Remember that making observations involve the use of your senses, your sight, your hearing, the smell, and touch. So when we tell you that caregiving takes the whole of you, yes, it does. Yes, it does. A good caregiver is an observant caregiver. A good caregiver is a caregiver that knows that you have to use your senses and consistently use the senses all the time. Now, how do you document? You must date every documentation. Write the dates. Today's date is, write an appropriate date. Write the time. Write your service user's correct name. Yes, ma. Yes, sir. Because it can be as that, okay, how am I sure that this document belongs to Mr. AA? How am I sure that this document belongs to Mrs. BA? How? Because there's no inference to this person's name. The name is not clear. So somebody can come and tell you that, no, you're using somebody else's document. The task you perform on your clients. The task you perform with your clients. How your client responds to your care. Oh, why is that important? Whose phone is ringing? I hope it's not here. How the client responds to your care. Oh, you gave this person a cup of lemonade and she took it very well with a thank you. That tells me that your client was happy drinking that lemonade. I offer a glass of water, just took a sip and didn't take again. Any changes you notice in your client's condition must be documented. So don't get used to, I can assure you it's very tempting to get used to saying the same thing every day. Yeah, it's very tempting to just do copy and paste reporting. I can assure you it's very tempting to do copy and paste. Very. But resist the temptation. If care was refused by the client, document it. Any care that's refused by the client must be documented. Any phone call or calls or oral reports you made about the client or his supervisor must be written. Include the supervisor's name and time. When caregivers call even me to report certain things, and I tell them, yes, it's good to verbally report, but it's not enough. And we had a conversation and all of that. It's not enough. Follow up with a message. Why? Can somebody tell me why? Thank you very much. I can deny you. Yeah. Anything that is not documented can be denied. Anything that is not documented can be denied. And honestly, it might not be that I wanted to lie or I just wanted to deny you. It might be that in the midst of several things, yes, you said something, I've forgotten, or I never even settled in. Maybe by virtue of the way it was communicated. All right? And so, you're raising your hand, MD, I called you and all of that. Really? When did we have that conversation? I can't remember. And truthfully, I can't remember. But you see, if you have your evidence, you have your evidence. So what that means is that that evidence helps you, and it's also a proof, and it also helps the person that you're communicating with. Okay? Because whatever is written, even if you had that verbal conversation and all that, and you have this on in black and white or in the message and all of that, you remember, oh, I'm supposed to act on this thing. I'm supposed to act on it. So, same thing for everybody. It might be your client's family members, it might be your client's, your service user's doctor, it might be anybody. Absolutely. Yes, do oral, but please follow up. Get used to it. Let it be a lifestyle. Get used to following up and say, thank you. It might even be a thank you. Thank you for listening to me earlier today, and repeat what you thought that the person said. Do you know that sometimes what you thought you heard is different from what the person is communicating or what the person wants to communicate? So it is important that you are on the same page. So get back and say, you said this and this and this. If it is correct, the person will say, absolutely, yes. If there is a correction, the person will say, no, 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 what I meant was, and it's written down. You call a doctor, your client's doctor, and the doctor say, oh, go and buy this and that. And you went, you bought whatever, and the doctor say, no, this wasn't what I asked you to buy. You have already administered something wrong to your client. You dare not. So even if it's your client's doctor or anybody, please be sure, write it back and say, sir, thank you, or man, thank you. You said I should. I just want to be sure that I got it correctly. You said I should buy so. If the person says yes, fine, go ahead and do it. That means you are safe. He says, no. Because there are some drugs recently, was it last week or so? A caregiver sent some medications. The client is supposed to be on the medication, but the supplier, the pharmacy or whoever it was that supplied something, and that's not the first time I'm seeing those kind of things. The pharmacy or the supplier will supply something else. And so she looked at it and said, they look alike. The name sounds alike. In fact, one of the medication is the same, but the one that the client is supposed to be on is a combination medication. So she said this. I said, the supplier just brought this, and it doesn't look the same. I've read through. I hope you as caregivers know you're supposed to read through. Yeah. I've read through. It doesn't look the same. So they forwarded it to me. I said, please tell the person, hold, don't dispense. Don't dispense. Inform them that this person brought a wrong medication. I got another one that, in fact, the medication that was brought, that was supplied, immediately she sent that to me. I said, it was an alarm. I said, please don't give. It's dangerous. Why would anybody give my client this drug? Of course, if you are a caregiver, you don't know drugs. So we're not asking. I said, please don't dispense. Inform the children immediately that I said don't dispense. That was later. They now went around and now, of course, sometimes the family can say, oh, why would you, well, they now went down and they now realized that, in fact, that drug particularly was a very dangerous drug. But if the caregiver has been careless, if the caregiver has not been observant, if the caregiver has not bothered to look, will have administered wrong medication on your clients, saying, but that was what they brought. You know what you said? You have to be very observant on your job. You are now in healthcare industry. And in healthcare industry, we are very careful. Very careful. Very careful. And of course, you close by your signature and your name. Like I say, I don't know everybody's signature. So if I get to your home and all that, and I'm seeing signature, I may not be able to decode who this signature is for. But write your name and sign your title. And that's a proper documentation. That is a proper documentation. Record only facts, not your opinions about those facts. We don't want to read. Just facts. If your client seems dizzy and confused, don't write what you guess could be true. Like, client acts like she's on drugs. Can you imagine a caregiver writing, somebody is confused in your reports? Instead of you to write, client seems a bit confused, you are writing, client acts like she's on drugs. Okay, so you think that if the family member would see that your report, they'll be very happy with you, because it's an insult. You might not take it as, that might be your own way of trying to describe. No, don't describe. Client is acting a bit confused and all that. That's all right. Stick to the facts. Client is unable to stand up without assistance and called me by her mother's name several times. It's okay. Don't say client likes to my clients like to pretend a lot. She'll just do as if she's just falling. Nobody is asking for your opinion. Record what a client tells you by quoting the exact words. If your client says, I want my daughter to visit, don't put what he said in your own words, such as, client misses his daughter. I want my client to visit me. It's not necessarily client misses her daughter. That is your own interpretation. That was not exactly what the client said. So you say what the client said. Don't put your own words. So we're saying, say the facts. Quote what they have said. Don't put your own interpretation. So we've gone through this, but for completion's sake, let me just say it again. Documenting on time means writing information down as it happens and turning in your reports when due. Your supervisor should not be running after you to submit your reports. Your documentation should be on time. You write on time, you send in your reports on time. Write down information immediately, because they are likely to forget. I can assure you. So sometimes when I see caregivers, if I go to the home, I get there at 4 p.m. and the report ended at 10. So I'm asking you, between 10 and now, okay, so you mean nothing has happened? How will you know the exact time that whatever it was that you did? If you don't have a notepad to show me, then that means you are not going to be correct, because you forget. Unless you have a notepad in your pocket. That's why your scrubs have got pockets. You have a notepad and a pen, so that if you are busy, but something must be there. Small, just this at this time. This, oh, you will forget. And when you forget, you now be cooking up time and date and all that. Correct. That your report will now be incorrect. Took vital signs and all that. Document them immediately. Don't wait until you leave the care or the client, to do anything. Okay. What you have a record? What record? A recorder, a voice recorder. Well, it can be acceptable. Okay, so why are you unable to write? Why would you do it? And so while your client is there, you're not doing the recorder. That client might not accept that song. The clients might not be comfortable with that one. You understand? The whatever you say, small notepads. Okay, maybe when next I'm coming to class, I'll bring small notepad, very small thing that I can put just to note. You understand? You can always take note of those things. They're not big bogus things, so that you're not going to be able to write into your report book all the time. You understand? But at least have something that you can use to take notes, and it's absolutely important. Even it's helpful also when you're having to deal with clients. You understand? Client is giving you instructions. It's absolutely important to learn the act of writing out what your client says. It helps you in communicating effectively, so that sometimes clients get angry because they have instructed their caregiver to do A, the caregiver went to do B. There was no clarity. So, but if you learn to document and all of that and say it back to the client, sir, this you said I should do this and all of that, and it's clear, you have less problems. You have less problems. The longer you wait, the more likely you forget some of the details. Absolutely. In fact, you will forget. Be sure that you take note of exam times on your documentation. Don't guess at the time or put general time frame like day shift. Day shift, even if it's day shift, you time whatever it is that you're writing. Time whatever it is. 7 a.m. Be through. We had this and this and this. 8 a.m. breakfast. Breakfast of what? 9 a.m. Your client is busy relaxing, or is going for an early morning exercise, or taking medications and all that. So depending, but I'll skip this. Okay, let me not skip it. If is your client, so there's a template for weekly reports, for example. So you want to know, is your client continent of urine and feces? Was there any diarrhea or constipation in the course of the week? Can you observe any pressure area? We are going to do pressure areas maybe tomorrow, medications tomorrow, and all that. Any changes in mobility? If there's any change, you need to report, oh, this week this person wasn't able to walk, or one aunt was not able to. Not that your supervisor will get there and realize that, what's happening? Last time I came, Papa was still able to ambulate. What happened that he's not ambulating again? And that's when the caregiver, the supervisor, we have since about 2 weeks time, he has not been ambulating. Who did you tell? Was that part of your report? Was any moving and handling aid introduced to your client? Is there any change in the client's feeding? Is the client now finding it difficult to swallow? Are you having to puree the food? Are you having to, so whatever, is the client eating a lot? Is the client not eating as much? All of those things are absolutely, see, all these things that are here, they're important to give us an idea of the current state of your client. Any recent hospitalization or visits, anytime your client goes into hospital, sees their doctor, and sometimes they will adjust their medications. Absolutely important that you report medication adjusted. This medication was stopped, this medication was introduced, or this dosage of this particular medication was stopped or increased, whatever it was, or the doctor just said continue the medications, as prescribed. Any abnormal reading in blood pressure? Was the blood pressure normal? Was it abnormal? And what was done? Any abnormal reading in blood sugar level? Just giving an idea of a state of your clients. Did you intervene when the vital sign or the blood sugar was high or low? What did you do? What was your intervention? Just like we have discussed earlier this morning. Okay, any symptoms of fever, dry cough, tiredness, aches and pains, nasal congestions, headache, and whatever it is that was noticed in the course of the week, report and send in your reports. Send in your reports. Whether safety issues, client statements and complaint documents, unusual events, and all of that. Your name, title, and signature. Different organizations might have different reporting templates. You understand? So you be careful how you 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 be careful how they want it reported and how you report. Any questions? Any questions? All well taken. All right. So do's on documentation and reporting. It's rounding up again. Stick to points. Remain brief and straight to the point. Don't use 4 pages to write 1 day's report. We'll ask you to buy a reporting book if you finish a book. So it's absolutely important that you are brief, you are apt, describe whatever you want to describe, and then, writing something like client ate 75% of lunch tray is much better than say client ate well. What's your definition of client ate well? So what we're saying is it's better for you to be objective. It's better for you to be objective. Client ate well. That's your definition. My definition of client ate well might be client finished and requested for more. That's my definition. And your definition is that at least client ate. So tell me exactly what it is. Observe each client carefully and document even small changes. And yeah. In your reporting, your documentation in a client's home is not about your colleague. So that is absolutely not the place where you are going to be reporting your colleague that you are working together or anybody at all. We are asking about information concerning your service user and clients. We're not asking you to report family. We're not asking you to report clients, your colleague that you don't like his or her face. So avoid writing about workplace problems like staff shortages. What has that got to do with? This is my 19th day on the shift, and the organization has it not to send somebody to replace me. Excuse me, how does that how is that part of your reporting on your client's book? Don't use language that sounds like negative feelings about a client. Instead of writing client is drunk, stick to the facts by writing client's breath smells of alcohol and he is slurring his words. We can interpret that. Just describe. I remember when I was younger, I had an uncle. One day we were going out, he was driving, and we were having a discussion. And I said, Uncle, it's a lie. I looked at him and said, never say that. And in my mind I was like, but that was a lie. But that was a lie, But that was a lie. And he said, in Africa, we don't say old people lie. Okay. Older person. So you will say another person is telling lie. So, in that sense, he's not asking you not to report the obvious. He's asking you not to use those words and present it in a better way. So you can say, oh, cool, is that really true? Are you really sure that was correct? But don't say it's a lie. So, don't say, grandma, you are going to do this thing again. So you are all drunk, and you're writing that in your report book. No. It can be offensive. Yes, we know, but it can be offensive. Don't use those kind of words. And don't mention the name of one client in another client's documentation. Just like you're writing about this person. Because he now works with a client that was now just like mama, this thing. Now, Don't document client care ahead of time, caregivers. Thank God I don't see much of that. I don't see that anymore. But I remember many years ago when we started, some clients, they will have finished writing. They know that they are spending 5 days or 1 week on the care. By the time they have written report up to Friday, like, okay, wonderful, very wonderful. And so you are now becoming a robot. No, no, that's a very, very bad thing to do. Don't write with a pencil. I told you, your documentation is a legal document. Pencil can be wiped off. Nobody will accept pencil evidence. So it must be ink. Use 2 different colors of ink for the same entry. Someone might think you are trying to be smart. So be careful what it is that you do. All right. Okay. Let's take this quiz together. Is it ever okay to document care before you give it? An example of an objective observation: temperature is 99.6, pulse is 74, respiration is 16. I know you might not be able to decode that one. What is true or false? No. Don't worry, I'll skip that because even the question is not complete. This reservation rate is not low. Don't worry, that's why I'm skipping it. Don't worry. See your vital signs, you'll keep repeating it for some time. Don't worry. I'll skip that for now. We'll come back. If your client refuses care, should you not document anything? What should you document? It's best to perform all your care on all clients first, then sit down to document everything all at once. Are you sure many of you are not doing that? You have the right to criticize the care given by any of your co-workers. Writing about workplace problems like staffing shortages tells your client that you are a good caregiver. Nobody can take care of you like me, you know. And caregiver, nobody can take care of you like me. I'm sure you're happier when like I'm sure that's why you always want me to come back, Abi. Nonsense. It is the standard practice to document your client care ahead of time. If you document a change in your client's condition, be sure not to write what you did about it. True or false? If I provide proper, accurate, and timely documentation and reporting, it will help in taking informed decisions. Proper, accurate, and timely documentation and reporting helps with statistical information that can be utilized for planning client care in the future. Use language that sounds like you have negative feelings about a client. Is a good way to document and escalate issues. Now, that's one of the problems that caregivers have. Because when you're trying to report, you're not using the right words. You're not communicating effectively. You are, instead of you to report, you complain. And when you complain, it's a negative one. Complain is negative. So we report facts. Does it mean that there are no issues that you need to report? You be careful and mindful how you communicate it, so that what you are trying to say is received well. After making your oral report, you should document the name and title of the person you reported to. True or false? Absolutely. Report to your MD. Ask. Report to your supervisor. If it's your manager, whoever it is that you reported to. But make sure that you understand line of reporting. So don't go and report something else to Mr. David if you are deployed somewhere and it's only you. There are lines of report. There are reports that gets to Mr. David. There are reports that gets to, so you understand different lines of reporting and all that. Any other questions? Any other question? You have a question? Yeah.
How best to report your core by colleague who is actually assisting like partner resources care for say service user. If what your actions is kind of a detriment to the health of the service user.
Yeah. That is reported. It's called whistleblowing. And that is reported to your supervisors, your managers, and the organization. It has absolutely nothing to do with the client's care and reporting and documentation in the home. That is an administrative issue. So that's reported directly to all those ones. You cannot record it in your client's document. No. It's not your client, it's not part of your client's reports. It's the organization that needs to have that report. Okay? So when you come to the organization and all that, you can report that and send. You understand? You can report, you even choose to do a voice note that only sends to your managers, your supervisors, and of course, like I always say, it's always better to put a face. When you come to the company, you explain. I've observed this, but you don't sweep it under the carpet. No, don't sweep it under the carpet. If it's a problem, if it's an issue of someone does not know, you understand? Because there are times that this person doesn't have that level of understanding. You understand? It's not that skilled, or he doesn't even know this area. You can guide and say, and if you've spoken to this person, or the person just refuses to change, of course, escalate by all means. Don't sweep it under the carpet, because it will be taken against you. Yeah, it will be taken against you. So you report. When you report, we at the back end, we know how to resolve that matter. You understand? So, face you, what's your problem? This that you're doing, do you know it's detrimental to the clients? Why were you sent to the home? Why are you doing what you're doing? Why have you refused to change? If the attitude is right, may I require that, oh, this person requires actually more skills. This person needs to be trained more. This person needs to be corrected. This person needs to be this. And if after we've done all of that, the person refuses to change, then it's off you go. Yeah. So the first thing, so sometimes caregivers say, I don't want to report to my colleague. It will be taken against you. Because when the chips are down, you are not going to be innocent. We will rub the two of you together. If you see, you must report. Yeah. You are an accomplice. Yeah. Any other question? Yeah. Any other question? All right. So let me give us how many minutes to stretch. You can stretch. The other one we're taking, well, I should give you how many minutes? Should I go and come back? I should go and come back. Okay. How many minutes should I give you? How many? 20 minutes. Okay. All right. No problem. I'll give you 20 minutes. All right.